Welcome to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein. And today we're going to be speaking to Dr. Chrissie Williamson on genetics and depression. So if you like this episode, please click the like button and subscribe. Hi, Dr. Chrissie.
Hello, how are you today?
Good, good. I'm going to tell everyone about you first, and then we'll get talking. So Dr. Chrissie Williamson's Nutritional Genomics Institute, NGI, and its innovative OmicsDx Genome Panels are reshaping our approach to healthcare and nutrition, recognizing the absence of a one-size-fits-all solution. Through groundbreaking research and personalized genomic analysis, NGI empowers patients to understand how their unique genetics, biochemistry, mindset, and risks influence their health. With a focus on sustainable, personalized lifestyle changes, NGI is at the forefront of emerging technology and medicine, empowering patients to take control of their health destiny. Dr. Chrissie, a nationally recognized certified nutritional specialist and licensed dietitian, nutritionist in Maryland, earned her doctorate in clinical nutrition from MAOIs and her master's degree in human nutrition from University of Bridgeport. Based in Richmond, Virginia, she's envisioned integrating a primary care physician's office with genomic, phenomic, and functional medicine specialists, seamlessly blending with laboratory data and appointments, and brought this vision to life at GenMedX. And GenMedX's medical care team, under the leadership of Dr. Christie, offers expertise in functional medicine and primary care, extending NGI's capabilities to address your comprehensive health needs. Dr. Christie collaborates with the medical care providers at GenMedX to ensure the ultimate patient experience. And to me, my heart is exploding because to me, this is the way medicine should be practiced.
Yeah, it should be.
Absolutely
So hopefully we'll
should be.
expand.
So people, functional medicine is going to be the face of healthcare someday. I promise you.
We can have it now.
Yes, yes.
Yes.
In one place. And hopefully we'll have 10, 20, 100, 1,000, all over the world, these types of places. So thank you so much for existing. So
Thank you for having me. I'm excited to be here.
yeah. So, I always like to have people start with what inspired them to come to this place. You went from point A to point B. Let's hear about point A here.
All right. Well, I think like many people who get into the functional space, it always starts with a personal journey, and mine does as well. So a long time ago, I guess it certainly ages us at this point when we talk about our children who are now in college. But when my babies were little, they had many health challenges, which involved ICU visits and stays and things like that. And I almost lost both of my little girls in the span of about 4 weeks. So
Wow.
one ended up having Stevens-Johnson syndrome, which for anyone who's not familiar with that, they essentially peel from head to toe from an allergic reaction. Um, so antibiotics were not our friends at
Mhm.
that point. And then my youngest, who I ended up having early because I was so stressed out from being in ICU with my oldest. So I had an emergency delivery, which was fun. They dragged me kicking and screaming downstairs from
Right.
the peds floor to the maternity ward. Um, she, because I was distracted and not, paying attention so much, unfortunately, she got a full hepatitis vaccine when she was only 3 weeks old, and she had encephalitis from that particular vaccine. So she was back into ICU and had to be shunted and all kinds of fun things.
Oh my gosh.
So yeah, it was pretty traumatic. And I was a young mother. I started having my children in my early 20s. So I was 24 when Emma was born and 26 when Penelope was born. So the stress of all of that, they basically told me to prepare myself, and that my youngest would likely, need assistance, and that she would probably be maybe potentially deaf and blind and mentally retarded,
Oh, wow.
which sent my body into a lot of panic and cortisol and stress, and put me into bed for a couple of years. So I saw hundreds of physicians, was given dozens of different medications, and eventually I decided that I would try my own way.
Mhm.
And that's what ended up working. I have two very happy, healthy little girls. We're not so little anymore,
All right.
but they are, none of the horrible things that they ever told me were going to happen happened.
Right.
And very early on, we started, learning about nutrition and that sort of thing. So
Hmm.
it was, blessing in disguise. But because young kids who were eating the traditional standard American diet, had no real concept of, what was, a good thing to eat and what wasn't. So, radically changed our lifestyle, our diets.
Hmm.
And, eventually I went back to school and got credentialed, and, now I do what I do. So that's how it all happened.
Yeah, yeah. When we have adversity in our life, it usually molds us into the people we are now, right? And it's taking the good with the bad, it's that yin yang kind of thing. So I'm so happy that those experiences brought you to this place. And so let's talk about specifically genetics and how they're connected to depression. We were talking about some things right before we started recording.
Yeah.
I was like, wait, stop, let's record this.
Talk about it. Okay.
So yeah, so and I know you sent me some slides, and we'll have them pop up as we go along.
Okay.
But so yeah, and you put in so much that we could talk about. Let's see how much we can squeeze in. So why don't we
Okay.
just start with, like, I love that you put in some of your what you'd like to talk about is resistant depression, because I absolutely, it's my biggest pet peeve is that diagnosis, treatment resistant depression. It's almost like there's something you're not doing right in order for your depression to get better, because our medications failed, and that really drives me crazy. So talk about it from your standpoint. What are the most commonly misdiagnoses for depression in your opinion?
Sure. So when I hear either another provider or a patient come to me and say, hey, we've got, a case of treatment resistant depression, and we go through the laundry list of medications that they've tried, I start thinking, okay, do we have anxiety with that? Do we have SI or suicidal ideation? Do we have OCD? If any of those answers are yes, I instantly start thinking about infections. And, most providers are relatively familiar with Lyme disease, and that might be the first place that they go, which is a really good place to go. It's an excellent start. But what they may not be more familiar with are co-infections.
Mm-hmm.
So, looking at things like Babesia and Bartonella and even ehrlichiosis, relapsing fever, those things, they aren't necessarily covered by insurance to do testing for things like that.
Mm-hmm.
And understanding the clinical presentation of some of those co-infections is, a wormhole for one. And you can, really get kind of caught into that. But, just to briefly talk about Babesia for a second, that clinical presentation overlaps dramatically with menopause. So
Mm-hmm.
if you're treating mostly women, you might go, okay, so, is it menopause or is it Babesia? You have hot flashes, insomnia, is that estrogen and progesterone, or is it Babesia that's also going
Right.
along with the anxiety and depression?
Right.
You're not sure unless you test.
Right.
Um,
Right. Mood
you,
lability.
right,
Yeah.
exactly.
Mm-hmm.
And then Bartonella, you might get a little cue, but it's, usually shin pain and foot pain, but also the decline in estrogen can also accompany, that's when we start getting frozen shoulder and joint pain and things like that as well. So, without actually testing, do we have neurobartonella? Do we have the babesia that's causing the intrusive thoughts or the OCD? So, those are our clues that if we have treatment resistant depression and we have some of those other diagnostic criteria that we really need to start looking at these infections. And
Right.
as functional providers, we're good at putting pieces together, and
Absolutely.
not, staying in our little boxes of diagnostic criteria. But just making sure that we're thinking outside of even the functional boxes, making sure that we're considering some of these maybe interesting infections that might be, a little outside the box.
Right, right. Many people consider infections to meaning having a fever and having acute symptoms. And what we're talking about, even though you may have sometimes an acute infection, and if you can capture that on testing, great. That's
Right.
easy. But when it's a chronic infection, when the IgM on the testing is gone, but there's IgG, that makes it much harder to know how long has that been there. And so, yeah, it's all of a matter of using the right labs and the people who know how to interpret those labs based on clinical presentation. So it's a combination of things. What's your understanding of other infections besides those? What about viral infection, other viruses, and dysbiosis, H. pylori, those types of infections?
Sure. I mean, there are lots of other viruses that can cause depression and anxiety. I mean, even, I'm not, I don't do it very often, but, things like Coxsackie viruses can cause,
Mm-hmm.
depression and tachycardia even.
Mm-hmm.
So things like that can, you would think, okay, it's a little bit confusing with COVID these days. Are we looking at myocarditis caused by long COVID? Are we looking at Coxsackie virus B causing, myocarditis issues? But when we have anybody that has any sort of anxiety or, acute anxiety, OCD associated panic attack type of anxiety, we really need to start thinking about some of those other sort of interesting viruses, they're not just hand, foot, and mouth. We
Right,
have to start thinking about something that might, have more long-term consequences.
right,
Of
right.
course, with dysbiosis, there are any number of different, bacterial combinations that can influence neurotransmitter function.
Mm-hmm.
So, the challenge with that is that, when we're looking at GI effects or any kind of stool testing, we are, getting a moment in time,
Mm-hmm.
or, a couple days in time if we're lucky.
Right.
So those are things that can really, they change. The microbiome will change within, a few hours with what we're consuming.
Mm-hmm. Right. Yeah. The most common virus that people have, it seems, is Epstein-Barr virus, also known as mono. And
For sure.
80% of the population have had Epstein-Barr virus. And it tends to, most conventional doctors see, oh, it's come and gone. It's not a big deal. Yeah, it's in your system. But I think it's very important to get titers, and anything that's above, and all four labs,
Mhm.
for the
Yes.
Epstein-Barr
Early.
virus panel, there's four titers that you want to look at, one IgM and three IgGs, and to look at the titers. And if they're four titers, four times the normal titer, then that's something that should be really addressed as a part of your treatment as
For
well.
sure.
Yeah, I think it's really
For
important
sure.
because that looks like chronic fatigue and depression and anxiety as well. It's a major
It,
root cause.
absolutely. Yeah,
Yeah.
we find that low-dose naltrexone and valacyclovir are very helpful for that. Even though it's a medication intervention, it does seem to really be effective
Mm-hmm.
across all viral spectrums.
Yeah, yeah. I mean, there's also a combination of monolaurin and L-lysine and olive leaf extract. So yeah, you can have conventional medications,
Yep.
there's natural supplements, and there's also, again, looking at foods, infections, toxins, stress, and hormones,
All
right?
the things. Yep, exactly.
Yeah. Yeah. So let's talk about if you had a patient with depression, what your first step, is approaching them from a nutritional genomics perspective.
Sure. So I think when I see a patient firsthand, I want to figure out what kind of depression they have.
Mm-hmm.
And, I think for new providers, that might be new news to them that there are two types of depression. For more seasoned providers, that's not new news, but
Right.
I'm a classically trained biochemist, so we really want to look at that aspect.
Mhm.
And so, a clinical perspective is a serotonin depression is what we think of as major depressive disorder. So, the isolation, the sleeping a lot, the, not enjoying your favorite activities or your loved ones, and really lack of motivation. So when I think
Mhm.
of major depressive disorder, that's the primary aspect, is the lack of motivation.
Right.
Um, Dopamine depression's a little harder to pinpoint, and when you ask people if they're depressed, they usually will tell you, "No, I'm fine." So
Mhm.
that's, is a little bit challenging. So when you start to dig a little bit more and ask them questions, more pinpointed questions, they can be, hey, so you have your favorite party that you go to every year with your friends, and, do you still enjoy it?
Mhm.
And most of the time they'll go, well, no, I just really don't like Sally or Susie anymore. That's really the
Mhm.
problem. And, it's, well, okay, well, how about your kids? Do you still enjoy going to your son's soccer game? So, your son, when he scores the winning goal, and you used to
Mhm.
get up and jump up and down and be so excited. And now you're just kind of like, meh, okay,
Yeah.
yay. Ooh. So it's like,
Yeah.
it's your child. You're supposed to be super excited. So
Right.
most of the time they'll start to register at that point that, okay, maybe the sparkle isn't quite there anymore. Maybe there's a little, lackluster,
Right. Lack of
and
right. Lack of pleasure, or also known as
right,
anhedonia, is
exactly,
the word, the medical term. Yeah.
exactly. So, I do think that that is something, I want to identify clinically what it is first, and then we can kind of dive into genetics.
Mm-hmm.
And at NGI and genetics, we always validate genetics with epigenetic testing, so organic acids and amino acids. So when
Mm-hmm.
we're looking to see whether a gene is active or not, it's very important for us to
Mm-hmm.
validate these things.
Mm-hmm.
So we'll start looking, but that's kind of where we start, is making sure we understand what type of depression, and then we make sure that we're testing appropriately so we don't cast too wide of a net.
Mm-hmm. Great, great. So so you're saying that there's two types of genetics, a serotonin type of genetic and a dopamine type of genetic. And so,
Mhm.
I'm sorry, type of depression. I said genetic.
It's okay.
Serotonin
It's
type
true.
of depression and and a dopamine type of depression. So, yeah, so when you do genetic testing, what are the things that you focus on?
So, like the dopamine pathway, basically, you're looking at, dopamine is going to, which is basically your happy neurotransmitter, is
Mm-hmm.
going to turn into norepinephrine, which is your focus neurotransmitter, and
Mm-hmm.
then that is going to turn into epinephrine or adrenaline. So
Mm-hmm.
you have this sort of beautiful pathway, which, if it works appropriately, then everything's kind of balanced. These are called your catecholamines. And
Right.
so this catecholamine pathway, if working correctly with all of its little enzymes in between those pathways, are humming along beautifully, then you wake up, you have enough dopamine in your system, and you're happy, and then you have enough focus, and then you have the appropriate amount of either energy or anxiety at the end.
Mm-hmm.
But let's take it up. If we have too much dopamine, if we have too much of that, sometimes we have schizophrenia. But in most cases, we're just really going to overconvert into norepinephrine. Okay,
Right.
so that might give us some OCD, overfocus. Maybe we are really, really concentrating on what we're doing. But
Mm-hmm.
in most cases, our body is then going to convert that into adrenaline. Okay, so we're going to have more ruminating, anxiety, and those types of things. All right,
Mm-hmm.
so I wish it could be that simple, but it's, there are degradation pathways that basically work out those other catecholamines. And we'll talk about that in a little bit later, because that has to do
Mm-hmm.
with our COMT status. And
Right.
COMT is our master methyl regulator, which is really, really important when we talk about whether or not you're going to have anxiety or whether or not you're going to be depressed. Okay. So that's
Right.
really our big linchpin.
So
Um,
just to slow down a little bit and let the audience know that when you say
sorry.
COMT, when you say
Mhm.
COMT, you mean COMT, which is a gene.
Correct. It is a gene. It's called Catechol-O-methyltransferase. And it basically is the regulator of all methyl donors in your body and in the methylation cycle specifically. So we have both global and local methylation in our bodies.
Mm-hmm.
And this gene helps to break down all of the catecholamines, so both dopamine, norepinephrine, and epinephrine, and then also estrogens. So
Mm-hmm.
for women, if you have a change in this particular gene, it's very, very impactful. So, we'll talk a little bit more about COMT and how it can impact your estrogen metabolism, increased risk for endometriosis, fibroids, estrogen dominance, those types of things.
Mm-hmm.
So
Mm-hmm.
clinically, we'll see how depression or anxiety and those types of conditions go together with estrogen.
Right, right. So the COMT gene or the COMT gene is an undervalued gene. Most people have heard about the MTHFR gene because of how the pharmaceutical world has elevated that because there's a quote unquote treatment for that using Deplin, which I don't recommend necessarily, but that's why sometimes people get that one genetic test is the
Correct.
MTHFR, and then they come in saying that they have this disease or disorder and not understanding anything really about it. But it's really important to get your whole genetic profile, not just one gene, and
Correct.
hopefully by the end of this episode people will understand better why. Right.
Correct. And I do want to make a comment here about the Deplin. So in the serotonin pathway and also in what we call the biocterin pathway, Deplin or methylfolate stands in for biocterin. And
Mm-hmm.
so that's actually the reason that it works. It's not actually a true treatment.
Mm-hmm.
If you do have MTHFR, which I call the celebrity SNP,
Mm-hmm.
so the celebrity SNP is really famous. It really doesn't deserve to be famous.
Right, I
And
agree.
it doesn't really. In the methylation cycle. So we have one carbon metabolism on one side, and I'm sorry, I can give you a picture of this. But on one carbon metabolism on one side, the MTHFR is at the bottom. There's methionine synthase in the middle, and this is actually the key regulator. So it's what we
Mm-hmm.
call a gene-gene interaction. And if you have a variation in MTHFR and you don't have a variation in methionine synthase, or you have enough B12, then all you really need to do is have enough riboflavin in your system, and MTHFR really doesn't matter.
Right.
So the correction of MTHFR is not actually methylfolate, it's actually B2 and B12. And
Right.
so people mistakenly give methylfolate for MTHFR, which is not the correct answer.
Right.
The
Right.
reason it works for depression is because it fits in the shape of the biopterin.
Right.
So, that is
Right.
something that does theoretically work, but it's because it sits into the pathway that makes serotonin, it makes dopamine.
Right. And riboflavin is vitamin B2, which is
Correct.
a major vitamin for detoxification and can cause problems with energy. So you really need, and energy is one of the symptoms of depression, not just in your body, but your brain. And so it can appear
Correct.
to be depression. Yeah.
Correct.
Right. So yeah, it's all connected, like there's all these pieces of the puzzle that people don't realize that really make a difference. And that, MTHFR became a celebrity because of Deplin, because of the marketing for Deplin. There's all these other genes, that are equally or even more important, but the only reason MTHFR, and that's what I think people need to understand. Why do we learn about these things on TV? And it's because of the marketing from pharmaceutical companies. And so I agree with you that there's these other factors that are just or actually more important. Yeah.
Well, and to kind of skip ahead a little bit, when we're looking at serotonin metabolism, there's a particular SNP called MAOI. So this is a
Mm-hmm.
monoamine oxidase, and there's a particular variant. It's RS6323.
Mhm.
And if you've heard of monoamine oxidase inhibitors, so this is like Marplan or Nardil, these are certain drugs that
Yeah.
specifically block this pathway. And for people that have this upregulation in this gene, it basically takes all of your serotonin and it degrades it very quickly.
Hmm.
So, this is a gene alteration that you would find in even young children that suffer from depression.
Mm.
So, when we're looking at treatment resistant depression, this is the gene that actually causes that.
Mm.
So, guess what the cofactor or the enzyme catalyst for this is?
Hmm.
Riboflavin. So,
Riboflavin. Hmm.
if you take more than 10 to 20 milligrams of riboflavin, which is incredibly common to find in a B complex or even a multivitamin, you will actually induce depression in these
Mm.
patients.
Mm.
So, it's something that's like I said, very common that, you'll go to your GNC or vitamin shop or whatever and be like, I need energy. I'm depressed. I need to take a B complex. That's what the Instagram celebrity told me to take. I'm going to go take a B complex. That's what's good for me. And then all of a sudden they feel worse. You need to start thinking, does this person have monoamine oxidase upregulation?
Right.
Because, and for patients that are listening, if your pee is yellow, you are taking riboflavin.
Mm.
This is the nutrient that causes your urine to be that bright yellow. So,
Okay.
this is something that is very easy to identify. And, it is something that if you have suffered from, either bipolar disorder, depression, anxiety, impulsivity, addictive behavior, you most likely have this monoamine oxidase upregulation issue.
And it shows up as yellow pea.
Yes, that's right.
A
So
bright
if you
yellow
have
pea,
yellow pee, yes,
neon yellow
neon
pea.
pee. Yes, it
Yes,
does.
that is great information. Great information. Because from time to time, patients have said, my pee is yellow. And
Mhm.
that's from the
Yep,
riboflavin, not from the B12. That's
correct.
interesting.
That's from riboflavin. Yes, B12 doesn't turn your yellow, doesn't turn your urine a color, but it is definitely riboflavin.
Awesome. That's great information. You've actually taught me something. Something I have always wondered. And yeah, so because there's no information like that, in the literature, you have to dig pretty far to, and even if you ask other functional medicine doctors, it's like,
I know.
it's the B12. It's the, there's assumptions made. So I'm so glad that you talked about that. That's
Well,
awesome.
good.
Yeah,
Well,
we,
good.
we we can all learn things. All of us can
It's
learn
true.
things.
Yes, all the time. Yes,
Yes,
that's the whole point of being in functional medicine is that we keep learning.
exactly.
It's a,
Exactly. I'm so glad
gotta
you
keep
brought that
learning.
up. Awesome. Yeah.
Absolutely.
So, oh wow, what else can we talk about? There's so much. I have so many questions. So let's see, how can we go to the next? So there was also, I mean, you were talking about variations of SNPs, the
Mhm.
MAOA SNP is the biggest one, right? The RS6323
Correct.
and the riboflavin. So what are some other SNPs that people should know about in terms of depression and anxiety? I mean, I know that there is also dopamine beta hydroxylase, an upregulation of that converts the dopamine to norepinephrine. Can you talk more about that and the COMT gene?
Sure. So dopamine beta hydroxylase has two cofactors, or basically catalysts. So you can kind of think of them that as they're not true catalysts in a biochemistry speaking, but in general terms, they basically make the enzyme go.
Mm-hmm.
So when we're looking at that, they've got vitamin C and copper. So one of the things, and just to kind of reiterate, dopamine turns into norepinephrine and then turns into adrenaline. So if you are taking your happy neurotransmitter and pushing it and taking it from one level and then turning it into norepinephrine, it's going to go like this. And so
Mm-hmm.
your dopamine levels go down, your norepinephrine levels go up if you take more of the cofactor. So for people who take lots of vitamin C, oh my gosh, it's a pandemic. I don't feel good. I need to take lots of vitamin C. And then all of a sudden they start to get depressed.
Mm-hmm.
Hmm, that
Mm.
might be a problem. Okay.
Right.
So upregulating genes essentially is a bad thing for people that have depression. So the same will also be true for COMT when we talk about that in a second.
Mm-hmm.
So when you think about anxiety, we basically have downregulated genes. When we have depression, we have upregulated genes.
Mm.
And when you are, so the message here for at least for dopamine is that if you take too much vitamin C, you could induce depression. Okay. And then also have anxiety maybe a few hours later. So that's not a good situation. The other thing that can happen is that since copper is our cofactor for this gene as well, for our ladies that opt to have a copper IUD, if you have a patient that comes to you, hey doc, I put a copper IUD in, 2 months ago, and I am so depressed and I'm panicking.
Mm.
This is your indication that you have a patient that is pushing through this particular pathway. Generally in medicine, we go, copper IUD is completely inert. It's not going to cause you any problems. This is
Right.
going to be fine. Not necessarily. Now, if they
Right.
choose to keep it in, keep in mind that our zinc to copper ratio is supposed to be 8 to 1.
Right.
Push the zinc, make sure that they have enough iron, those types of things. That's a very important ratio that we need to keep in mind. But in most cases, most women are going to go, I want this thing out of me. I feel terrible because
Mm-hmm.
they most likely have that upregulated gene anyway.
Right. Right. I
Okay.
have had so many patients have that copper IUD removed. Yeah, and they
Yeah,
feel so much better after. So much better.
it's a
Yeah.
thing. It's
Yeah.
a thing. So when we're talking about the relationship between the catecholamines and how they break them down to get through COMT. So to kind of get to my favorite snip over here is is catechol-o-methyltransferase. So when we're trying to, look how the body is going to regulate this master methyl donor, or, look at how the body regulates methyl donor. So you were talking about MTHFR. People
Mhm.
look at that and they go, this is how the body makes methyl donors. Well, sort of. This is how the
Mhm.
body generates or recycles a methyl
Right.
donor.
Right. It passes it on. It passes it
Passes.
through.
Right.
Right.
It's like, collect $200 and pass go. That's how I always talk about it when I teach it. It's like, okay, we're going to pass it through to methylation from one carbon metabolism. But
Mhm.
when we get rid of a methyl donor, it either goes through homocysteine, through
Mhm.
catabolism, or COMT basically takes it and breaks it down.
Mhm.
So once it gets over to our neurotransmitters, which is what most people need help with, okay? So when a new patient walks into your door, do you treat sort of what's, the really complicated thing, or do we manage mood disorder first, because we
Mhm.
really need compliance and mood management first before we really can deal with changing diet or any of those kinds of things afterwards, right?
Right.
So
Right.
you don't feel good, you're probably not going to be like, oh yeah, I'm going to go walk 10,000 steps a day, or those kinds of things. You really have to help them feel better first.
Mhm.
So COMT, if you have a slow variation, and this is a little tricky because if you look at your genetic testing, fast is going to be green. Okay. So when you look at if you were going to put it in a genetic genie, or if you were going to put it in a better processor like Livwello, you are going to see fast val be green and look normal. These
Mm.
people, again, fast, anything fast in terms of depression is bad.
Mm.
Okay. So
Mhm.
fast people basically break down dopamine, which makes you depressed. They break down norepinephrine, which makes you have poor concentration issues, so ADHD. And
Right.
then they break down adrenaline, which makes you super tired. Okay.
Right.
So this is our phenotype for depression across the
Mhm.
board. So the cofactor for COMT is magnesium.
Mhm.
So if we are giving these patients, everybody needs magnesium, right?
Right.
So if we're giving these patients 350 milligrams of magnesium, what are we doing? We're inducing depression in
Mm.
these particular patients. So, but it was green, right? It looked normal. So
Right.
magnesium is great, right?
Right.
Maybe not.
Up to a point.
Um,
Right.
up to a point. So now the reverse of that, if you do have slow COMT, you literally cannot take enough magnesium.
Mm.
We joke at NGI and say that if you don't have COMT, you can't work for Dr. Chrissy, because if you have, and this is totally a joke for anybody really listening, but if you basically, and I have slow COMT, this is why we say this, but it is essentially, we call it the CEO SNP. If you have slow COMT, you are more likely to have estrogen dominance issues, which obviously can be a problem. But if you take care of that by taking enough magnesium, then your estrogen issues will be balanced. It is actually a benefit in perimenopause.
Mm-hmm.
Since we're at that age now, I can say that it's a benefit. But in younger years, you will struggle more with weight imbalances and things like that if you're not careful.
Mm-hmm.
It does increase your risk for obviously endometriosis and things like that as well. So do be careful with that. And we always kind of joked that I'm a little afraid to say this on air, but when before I started taking Neuromag, I would be yell at people in the car and be very frustrated with my children or my ex-husband, or have anger issues and kind of explode, and then afterwards go, who am I? Why
Right.
can't I control myself? What is all of this extra in me? And it was somebody who wasn't me, and I didn't
Mm-hmm.
understand it
Mm-hmm.
as a young woman. And then finally, I had all this ruminating anxiety, all of this stress. And then finally, when I started doing genetics, I genotyped my entire family when my children were sick.
Right.
They were the first subjects of despair. I looked and I found out. And so I finally started taking appropriate amounts of magnesium 3 and 8.
Mm-hmm.
And my life literally changed overnight. I
Wow.
finally had a sense of peace, calm. I could sleep. I had absolute control over my emotions, over my
Mm-hmm.
thoughts. It was a miracle. I
Mm-hmm.
call Neuromag a miracle, a
Right.
miracle supplement.
Right.
Um, this is
That's
something that
awesome.
helped, yeah, keep my dopamine levels nice and balanced, my focus nice and balanced, but my adrenaline finally was able to come down. So no matter how much I was exercising, it still wasn't enough to actually metabolize out of the system.
Right. Right. That's great. That's really great.
Yeah, there's
Yeah.
a part. But yeah, so understanding that, basically for slow compters, really important to have magnesium on board. And you
Hmm.
will again have that ruminating anxiety. For fast compters, you're at significant risk for depression. Avoid
Hmm.
excessive magnesium, no more than 250 milligrams a day.
Hmm. Yes. That's awesome. Yeah, it's interesting because when you talk about all the symptoms, I can pretty much tell people what their genes are
Are
without actually doing the genetic testing. It is an extra cost. And I do genetic testing when it's like, okay, we're stuck here. We got to figure out what's going on here, why you're having
yeah,
these issues. And it is really, really helpful. But with the understanding of that, food is medicine, lifestyle, can make lots of change, turn off the quote unquote bad genes and turn on the good
genes.
genes, the phenotypic
Yeah,
expression of your genes, and the genes are a blueprint. But sometimes you really need to look at the genes.
sometimes. Yeah,
So it certainly is an option for my patients.
yeah.
And yeah, and so yeah, it's great to hear all of this. I'm very grateful for your time. Is there anything that you think we should definitely mention or talk about right now before we end? Because while I have you, is there anything else that
Sure.
you think that we haven't discussed that's really, really important for people to know?
Hmm. So, just a few tidbits.
Mhm.
Iron deficiency, hypothyroidism, those are things that you really need to be cautious about if you are suffering from serotonin depression.
Mhm.
So, those are a couple of relationships there. And then I want to mention the relationship between stress and depression. So, pathway wise, a norepinephrine turning into epinephrine, if you are a fast compter, so if
Mhm.
you do have depression, there's a defined relationship between having stress and heart disease. So The
Mm-hmm.
norepinephrine to epinephrine conversion, the methyl donor turns into homocysteine. So you basically drain all of your methyl donor. So the methyl donor controls things like cancer risk, heart disease risk, all of those things. But if you are suffering in your depression state and then you also have chronic stress, you are at risk for heart disease. So making sure that you replace that methyl donor, but then also regulate your homocysteine. So what degrades homocysteine is vitamin B6. So this is
Mm-hmm.
why we talk about P5P being so important for depressive states, is that we make sure that we break down homocysteine, but then also making sure that we're generating serotonin because that's also responsible for that pathway.
Right.
So lots of complex biochemistry, but if we're looking at things that would be very helpful for depression is managing the amount of magnesium, making sure
Mm-hmm.
that we're not iron deficient, making sure that we balance our thyroid and that we have enough vitamin B6, which can be measured by looking at xanthuronate on an organic acids test or a serum B6.
Mm-hmm. Awesome. Yes. Yeah, I do organic acid testing, and it does show the serum B6 levels as well as B2 and B12. And I cannot tell you how many people are their B6 level is very, very low or even non-existent.
Yeah.
So yeah, B6 is really, really important. Um, so yeah, I think we talked about a lot, and I'm sure that much of this is going over some people's heads and will require listening to this video again to kind of just get, like really have it get themselves get and understand this because it's complicated. It's very complicated, and we gave a lot of information in a short amount of time. And I think the big thing for people to know is that genetics can give you lots of clues as to what's going on in terms of certain things happening in your body that manifest ultimately into depression and or anxiety, and that there's solutions. It's about being a detective and finding those pieces, those puzzle pieces, and putting them together and really having a very personalized plan, including, and that can include genetics. So I know you have an offer for a free genomic kit after an initial appointment. And is that with NGI or is that with a different company?
It's with NGI. So all three companies are related. So you can be with NGI or with genetics. If you decide to do any genetic testing with us, we'll give you a free genome kit.
Okay, and that's the OmicsDiagnosis Genome Panel?
Well, not the panel itself, but you have to have a genome kit to do any of the panels. So we have 25 different panels that you can choose from. We
Uh-huh,
do have additional panels that aren't listed if you have a specialty request or something like that.
uh-huh.
But we will give you a free genome kit so that you can
Awesome.
choose one of your panels.
Okay, and you are located in Richmond, Virginia, and I
Mhm.
have your website, nutritionalgenomicsinstitute.com and ngigenmedics.com.
Thank you. Yes, we're actually in California, Virginia, and Maryland. So we're telemedicine, but I'm physically located in Richmond.
Oh, okay. Awesome. Awesome. Great. Well, thank you so much for your time, Dr. Christy. I really, this was great. I learned something new too. And, it's been a real pleasure to have you.
Thank you for having me. It was wonderful. I enjoyed it.